Hello, this is the lab prep for body mechanics, mobility, hygiene, range of motion, and anti-embolism stockings. This is a very busy lab. Prep for this lab includes the Mosby's videos and quizzes that need to be done prior to coming. Also, there's two chapters in your used fundamental text, chapters 27 and 28 that you can use as references if you so choose. And they may flesh out some of, if you don't understand, some of the videos. Also, please bring your book to lab because we will be using that in lab. I'd like to mention here universal steps for all procedures, and I want you to build this into your practice, commit to memory. Before every procedure, you have a certain group of things that you need to do. What do you do before you approach the patient? How do you prepare them? You gather your supplies, you wash your hands, etc., that sort of thing. And you do something every time post-procedure. You throw things away, you tell the patient what you're doing, you make sure the patient's safe before you leave the room, etc. So take a look at those. They are printed before each skill in your textbook, and it's something that I want you to be practicing while you're in the lab. Learning outcomes, pretty straightforward here. This is what we'll be doing in lab. You will be working in pairs, and there will be skill stations that you'll work through. Ergonomic challenge. This is where we start, okay, your business is going to be working with patients and people, patients, clients, whatever. And this really makes a point. The adult human form is an awkward burden to lift or carry. Weighing 200 pounds or more, it has no handles, it's not rigid, and it's susceptible to severe damage if mishandled or dropped. So if you think of it, this is our business. We are moving patients, and we really need to know how to do it safely. So why learn about body mechanics? Because we want to make sure that you stay safe and your back stays absolutely as healthy as we can. And it is our responsibility to keep the patient safe. And you'll do that by using proper body mechanics when you move them. We need to make sure that you conserve your energy. This is a physical job. We need to be able to, you'll need to be able to move multiple folks depending on the type of work that you do, and we need to keep the strain down on your body as at all possible. What you think of when you think of body mechanics, the components are alignment, balance, coordination, and joint mobility. All of those need to be in sync in order to make sure that you stay healthy. 4 things to remember when you're moving or for proper body mechanics. Keep your feet apart. If you keep your feet together, it's more like a totem pole that's going to fall over or something like that because you don't have a wide base of support. Bend your knees and use your back, but make sure that back is straight. Keep your back straight and use your legs when lifting. Keep an object close to you, and even if you're lifting it off the floor, lifting it off the bed, you are moving a patient. You want that patient close to you. Keep your feet in the direction of the weight. Important, do not twist your back, because if you've got weight in your arms, you're twisting your back, you're susceptible to injury. And I have colleagues that have hurt their backs doing something incorrectly that have literally lost their career and gone on disability. So I cannot impress upon you how important body mechanics are. Basic principles, make sure you're clear and concise when you're moving a patient. In this case, we have a schematic here that has 3 nurses rolling a patient. Make sure you have enough people. Don't do it by yourself. Believe me, you don't want to do something quick and hurt yourself. And when you have 3 people working together, one should be the leader and be clear on what's to happen next. And also remember, there is a person that you are moving, and that person can hear you. Even if they are unconscious or something like that, please keep in mind that it is a person and tell them what you're doing, even if you don't think they hear you, because they may. Terminology is important, and what these schematics show you are different positions, and each position has a different terminology, has different term. For example, upper left, supine. I think of up in supine, up. Prone is face down. Fowlers or semi-Fowlers is head to head up. Over here, you have a lateral position. Here's a client laying on their side. It happens to be a right lateral. And then down here is a right Sims position. You can see the rotation of the shoulders and hip. So you will need to know that terminology, and we will use that in lab. Another portion of the lab is hygiene, and it is your responsibility to make sure your folks stay clean and dry. And that part of that, besides giving a bath, is perineal care. And I just want to say, what if you were in the bed, you couldn't take care of yourself? How would you feel if you weren't clean? So, folks, I want you to get used to it, get over it, and get on with it. There's probably some of you that have never done this before, maybe not even had children to wipe their bottoms. And it's something that we need to do. We are professionals. We get the job done. And don't think that you're going to have someone else do this for you. There are plenty of times where you need to do this yourself. So prepare yourself that this will be part of your practice. You'll also be making the beds in the lab. And I want you to think of how we do when you make the beds. How is it different than what you do at home? If you're like me, you throw your linens on the floor, you just grab them, you throw them on the bed, that's just the way we make beds. But in a residential facility or a hospital, you don't want to shake linens. That you can get microfibers in the air that could bother people's breathing. You can also, we want you to put pillowcases on differently. We're not going to be shaking the pillows. And please don't put the used linens on the floor. The floor is filthy. I don't care if they've just cleaned it. It is full of nasties. So make sure that you put the linens into a linen container, and make sure that you try to avoid touching your uniform with the linen, so you kind of hold it out a little bit when you walk them over and put them in a linen container or whatever. Remember that you can actually elevate the hospital bed or maybe in the facility that you're working, so save your back. If you can do that, please do. I'll teach you, go over mitered sheet corners. I think my personal opinion is I like to see client rooms clean, neat, and tidy. And that means not just completely thrown, the linens thrown on the bed. To me, it shows that the patient is being cared for, the family comes in, the room is clean and neat, and also you're a professional. You're not working with sloppy rooms, sloppy beds. So please make that part of your practice. And we also be using a draw sheet. The draw sheet is like half a sheet that we'll put under a client, and it's so much easier to move them using a draw sheet. We'll practice this in lab. So when you're making a bed, use precautions to prevent the spread of infection. It may be a dirty bed, who knows. You may want to wear gloves, and you certainly want to wash your hands before and afterward. As far as moving clients are concerned, there will be provider orders, and you have to make sure, whoever you're working with, that you know what are their mobility orders. And here's some examples. Up ad lib means up ad liberty, and that means this person can get up and down as they wish. They don't need to have you around. Out of bed to chair, pretty self-explanatory. Bed rest means you can't get out of bed, and you know what bed rest can do to folks if they stay in bed for any length of time. You lose muscle, you get weak, etc., etc. So we want to advance people as much as you can, if possible. Bed rest, except for bathroom privileges, straightforward. Turn every couple of hours and ambulate with water. So these are samples of what you'll see. There are more, but I wanted to give you an idea that you need to look for these orders. And if you have a client on bed rest or even partial bed rest, please prevent complications. And that's why we're doing range of motion in the lab, because if we can keep those joints mobile and that we're keeping the blood flowing, we're keeping muscles moving, and it's just good practice to do that. You want to position your patient for lung expansion. So essentially, you don't really want them in a prone position unless there's a medical reason for it. You want to have their head up, maybe in a Fowler's position, so they can breathe easier. And when you get these folks out of bed, just make sure you do it slowly, because they can drop their blood pressure. If you've ever gotten up quickly and you're dizzy, that means that your blood pressure has dropped. If you've been in bed, that's even more pronounced. And you saw the order on the previous slide, turn patient to prevent pressure ulcers. Take a look at this, buttocks. This person has been on that buttocks too long, and that is a preventable pressure sore. Mechanical lifts you'll be seeing in your practice. We don't have it in the lab. Those are all different types, but I want my takeaway here is please don't do this by yourself. Always have someone else with you. I think it's safe to do that in a lot of facilities. It is the policy. So please don't do this by yourself. That's the end of the prep for this lab. If you have any questions, you can see me or email me, and I will see you in the lab. Thank you very much.